Hi, I'm Dr. John Dowd, and I'm here today to share some ideas with you about wellness interventions as they relate to depression. Specifically, I just want to cover two wellness interventions today, and those would include some new data on exercise as it relates to the treatment of depression, as well as meditation as it relates to the treatment of depression. So if we first start with exercise, it's actually very interesting. Many of us for many years have known that exercise is something that makes us feel better, both physically and now we know mentally. So it's quite interesting. Some of the new data actually supports the fact that exercise affects the brain in many of the same ways that meditation and psychotherapy affect the brain. So we can literally show with data now that with the correct amount of exercise, a person's brain can change in positive ways, much as it does with treatment in terms of medication and psychotherapy. So what we know is that what we now consider a, quote, public health dose of exercise is approximately 30 minutes of exercise, a minimum of 5 days a week. This is considered a generally healthy dose of exercise. It turns out that some, however, will require 45 to 60 minutes per day in order to achieve essentially a reversal of obesity or negative conditions that may come from overeating or under-exercising for many years leading up to the period of exercise initiation. So it's again very exciting information on exercise and how it affects the brain and the body. There's literally an emerging evidence base on the so-called neurobiology of exercise, much as there has been on the neurobiology of depression, the neurobiology of bipolar disorder, etc. So there's tremendous legitimacy in terms of this new data and evidence that we have about exercise and its effects on depression. So experienced clinicians are now literally prescribing exercise to our patients. It's actually become something that's been very helpful in terms of being able to give a person a written prescription for a pharmaceutical and at the same time give them a prescription for how much exercise may in fact enhance that pharmaceutical. So I think it's made us better clinicians and it's certainly made for better outcomes in our patients. Second part of what I want to address quickly is this new emerging information on meditation. So it's quite interesting. Specific mindfulness meditation, as it's called, mindfulness meditation, as it's called, is becoming very also intriguing in terms of a treatment modality to augment or even sometimes replace medication treatment for depression. And it's actually very compelling. Some of the new evidence will show that mindfulness meditation interventions are outlasting, if not equaling, medication in terms of remaining free of depressive remission, free of depressive relapse. So once again, said a little bit differently, mindfulness meditation may in fact sometimes replace medication in someone who's not treatment responsive, or at the very least serve as an interesting augmentation agent. So what we've reviewed today are two kind of interesting wellness interventions, both of which are essentially add-on therapies, if you will, to medication treatment, psychotherapy treatment, and these are kind of, again, giving further and further support to the idea that a multimodal treatment paradigm is what's ultimately going to achieve the best result for us and for our patients.